A promising new approach to treating depression may come from an unexpected source: laughing gas. Known for its use in dental procedures, nitrous oxide is now being studied for its antidepressant effects, particularly in people whose depression has resisted traditional treatment. The findings are fascinating, and they raise both hope and concern. Scientists have long searched for faster, more effective treatments for major depression, especially for the 1 in 3 patients who don't respond to standard therapies. These individuals, classified as having treatment-resistant depression, TRD, often endure prolonged suffering while waiting for medications to take effect, if they work at all. With the rise in mental health crises and suicidality, the need for fast relief is undeniable. That's why recent research into fast-acting substances like ketamine has generated so much interest. Now, nitrous oxide, a 19th-century anesthetic, has entered the conversation. According to a new study published in Nature Communications, researchers from the University of Chicago, the University of Pennsylvania, and Washington University found that nitrous oxide could deliver almost immediate mood improvements in patients with TRD, with effects lingering for up to 2 weeks after a single dose. This isn't the fleeting euphoria people might associate with its nickname, laughing gas. At low, clinical doses, the gas works as a sedative, calming patients rather than making them giddy. More importantly, it seems to reactivate parts of the brain that become dulled by chronic stress, a key feature in depression. The findings are promising, but they're also troubling. Because as much as nitrous oxide represents a potentially powerful breakthrough, it's also a double-edged sword. This is a gas with a history, not just as a medicine, but as a recreational drug known for its dissociative and addictive properties when misused. As interest grows around its use in psychiatry, so does the risk of overuse, misuse, and unintended consequences. Mechanistically, nitrous oxide appears to work by unlocking neurons in the cingulate cortex, a brain region deeply involved in mood and emotion, that become suppressed during periods of stress. It blocks specific potassium channels, allowing certain neurons to remain active and restoring a level of neural engagement that mirrors healthier mental states. This activation happens quickly, even after the gas itself has left the body, and could be the key to its rapid antidepressant effects. But here's the concern: we still don't know exactly how long these benefits last, or what happens with repeated exposure. Nitrous oxide doesn't come without risks. Long-term or high-frequency use has been linked to nerve damage, vitamin B12 deficiency, and even cognitive decline in extreme cases. The fact that the effects wear off in a couple of weeks may seem like a manageable window until we consider what happens next. Will patients need another dose? Another session? Are we heading toward a cycle of dependency on a gas that has to be administered under supervision? Then there's the larger issue. We're again putting the weight of emotional recovery on pharmacological shoulders alone. While it's exciting to see new fast-acting treatments emerge, we can't afford to treat these tools as silver bullets. Depression is complex, often tied to social, psychological, and environmental factors. A gas that lifts mood for 2 weeks does little to address the systemic causes of suffering, loneliness, trauma, poverty, burnout. There's a danger in mistaking a spark for a solution. Still, the research deserves recognition. What the scientists have shown is that our understanding of antidepressants may be too narrow. We've long believed that NMDA receptor pathways were the key to fast-acting effects. Now, the discovery of SK2 potassium channels as another route could open the door to an entirely new generation of drugs, possibly ones that don't rely on inhaled gases, but could be taken orally, safely, and at home. If that happens, it would be a massive win for accessibility and patient autonomy. For now, though, caution is warranted. Nitrous oxide may become a useful tool in the psychiatrist's toolkit, especially for those who've run out of options. But it must be approached with care. The last thing anyone wants is to swap one form of helplessness for another, or to see a potentially life-saving substance become a crutch, or worse, a hazard. In the rush to solve one of the most pressing public health issues of our time, we need to ask hard questions. Not just can we use this, but should we? Under what circumstances? And at what cost? The idea that relief could come in the form of a common anesthetic is tantalizing. But like everything in mental health, the answer isn't just about chemistry. It's about context.